Hi everyone, really excited to start our first part of our mini-series. Today's topic is myths and misconceptions in plastic surgery. We're going to talk about the top 5. These are things that have come up over the years that I hear from patients on a regular basis, and it really creates a lot of confusion and misunderstandings about the potential impact of the field, and I think it's really worthy of discussion and understanding. So without further ado, all right, guys, so let's talk about myth number 1. Results are always unnatural. So this is a very, very interesting topic because I think when all of us, me included, am out and about and I see somebody who looks a little different, a little unusual, the natural inclination is that this person must have had plastic surgery, because why else would they look so different than everyone else? Now that could be because their face is pulled so tight, they look like they're going through a wind tunnel, or their eyes are slanted in unusual ways. Could be that their nose is too small for any human face to be, or that it's collapsed. Maybe it's something on their body. Maybe their breasts are out of proportion to their body frame. There's a number of these type of disproportions and interesting sort of differences that make us think that the reason behind that is plastic surgery. And the reality is 99.9% of the time, that's exactly right. It is because of the plastic surgery. Now, it doesn't mean that all plastic surgery produces those type of results. And that is where the myth lies. Because if it's well done plastic surgery, and what well done means is basically techniques that are very, very natural producing. That means that the surgeon is extremely talented as well as experienced and has a good skill set to offer. The results are imperceptible to what everyone else in the community looks like, the way people look in nature. And as a result, they're undetectable. And that is, for us in our practice, has been actually the greatest draw for patients coming from all over the country and outside of the US, is because the hallmark of our outcomes are that you can't tell what somebody has had done. So if they're sitting in a restaurant, no one can observe any differences. If they're out and about and they're with their family members or their children, no one can tell a difference. And the reason for that, again, is based on certain types of techniques that are employed, experience, the talent of the individual surgeon, and that's the results of it. So by no means do all plastic surgery outcomes look unnatural. And I would go as far as to say only poorly done plastic surgery outcomes look unnatural. And that's a very important distinction to make, because so many of you may feel scared to take that step because you assume that if you get something done, you're inevitably going to look weird or unnatural. And that is not the case. You just need to do a little bit more homework and differentiating between the different types of surgeons and the different types of techniques. And as they say, a picture is worth 1,000 words. And if you just look at the before and afters, that hopefully should be reassuring. Myth 2 is that cosmetic procedures and plastic surgery procedures are all about vanity. And it's interesting because it's easy to imagine that that would be the case because it's something so personal that you're doing for yourself. However, the reality is, over the years, 15, 20 years of interacting with patients from all types, you recognize that there's an underlying reason why people undergo these procedures. And it has very little to do with personal vanity, and it has very little to do with just simply wanting to do something frivolous to make themselves look better for the sake of looking better for somebody else, for example, or to, expand their social abilities or any of that kind of stuff. What it really comes down to is something very, very primitive, almost genetic. And what it is that within our DNA, we want to look our best. That's the number one simple reality that every human being on earth shares. We know this because we care about ourselves with our personal grooming, with our hygiene, with the clothes we wear, with everything else that goes along with our fitness and our lifestyle and all the other things. It feels good to look our best. And cosmetic surgery as a category is there to help enhance that aspect. And specifically when it comes to aging face changes. For example, the number one thing I hear from patients is, I no longer look the way I feel. And that is a very, very sad thing to think about, because if you look at the way the aging continuum happens, you look pretty much like the same all the way from your teenage years until probably mid-40s or late 40s. And then all of a sudden there's a shift that happens, and that shift occurs with the onset of aging. And when aging happens, the face elongates, the skin around the eyes get a little bit heavier, you get bags under the eyes, And for all intents and purposes, you are unrecognizable to yourself. And that's the number one thing I hear from patients that when they come in is that I don't feel like myself anymore. I feel great on the inside, and I get a glimpse of myself in the mirror or a photograph, and it's like I'm looking at two different people. And that is really the core of facial rejuvenation procedures, and that's the way I treat the procedures, is just to basically restore the outcomes and not to change their shape, because that's really what the need is. On the other hand, you have cosmetic procedures like rhinoplasty, where you have a young woman or a man who feels that their nose doesn't fit their face. And they're insecure about it. They don't like taking photos. They only interact with people in certain angles because they don't want to have them see them from their profiles. It's exhausting emotionally and mentally to always be conscious of these type of changes. Then they come in, we evaluate the situation, we perform a rhinoplasty, take the hump off or narrow the tip a little bit, whatever the individual's concerns are, and then suddenly they're liberated and they're free. There is a tremendous amount of science in the sociology as well as the psychology literature that speaks to this very point, that these type of procedures will not only enhance the appearance, but they enhance our self-image and our self-confidence. And as a result, that's the underlying reason why individuals have procedures done. So myth 3 is that plastic surgery and cosmetic surgery procedures are only for the rich and famous. Now, I think this is something that has been ingrained in us, through multiple generations of impressions, because we see this on Hollywood. We see people in the acting and entertainment industries have these type of procedures. We don't always know somebody who's outside of those industries who have a procedure like this. So it's easy to understand why we have this impression, why we have this myth that these procedures are reserved for those who are, either famous or rich or somehow in certain type of industries. Now, again, after 20 years of dealing with patients, I can tell you without a question, without a doubt, that plastic surgery serves everyone from all walks of life. I'm personally also surprised that I may have had some of these impressions myself. I see people who are, they're teachers of elementary schools, they're nurses, they're doctors, they are farmers, literally in the middle of nowhere, and they see hardly anyone other than their immediate family, as well as the individuals who help them. They have no social reason to have these procedures done. However, at the end of the day, no matter what walk of life you come from, whether you're an executive, whether you're an actor, or actress, or model, the underlying reasons are the same as we talked about in myth 2, which is simply that it feels good to look your best. And that doesn't make anyone exempt of those criteria. And as a result, we see people from all walks of life, from students to every aspect, coming in for plastic surgery. And the reasons are all the same, as we discussed in myth number 2. So myth number 4 is that plastic surgery is only for women, and that only women get plastic surgery. So it's interesting because I think, again, there's some truth to that myth, but it's not actually completely true. Despite the fact that the majority of cases that are performed for women, and that's partly because of the type of procedures that are out there. Breast augmentation, for number 1, is like one of the most popular procedures that are done, and is obviously one of the most noticeable changes that are performed. But the category of plastic surgery that men utilize is actually pretty broad as well. Men undergo liposuction for certain type of body contouring. Men undergo rhinoplasty. Men undergo facial rejuvenation, eye rejuvenation. These are all things that men participate in. And in fact, the largest growth group within the realm of plastic surgery is actually men. And on a given week, we treat several men in our practice. Sometimes there are men who come in for the procedure just by themselves, or because they've seen what their wives have gone through, and that motivates them because they know that they can get something natural and address their concerns as well. Myth number 5, all plastic surgery is cosmetic. So this is an interesting point as well, because again, plastic surgery is most noticeable and most popularized in the cosmetic areas, right? I mean, we think about all the actors and actresses out there that have had procedures done, so we assume that there's a significant cosmetic aspect to plastic surgery, which there is. But plastic surgery is extremely broad. Not only is there reconstructive aspects for when somebody has had some type of injury and they have to be restored and put back together. That's a very, very big part of plastic surgeons' day-to-day work that is performed. Cancer reconstruction, traumatic injuries from car accidents, etc. There's another category of plastic surgery which I spend a lot of time doing, and I consider it as restorative plastic surgery. And what restorative plastic surgery is when it deals with an individual's changes that happen as a result of aging, and they have nothing to do with changing the overall look to an individual. Because remember, cosmetic means that you're born looking one way and now you're changing the way you look. That's the category of cosmetic. So rhinoplasty, breast augmentation, those type of things fall under the realm of cosmetic. Under restorative plastic surgery, you look one way your whole life, and then aging starts stripping you of your youth and beauty and even your self-identity, and that becomes the underlying reason why we perform those procedures, to simply bring you back to where you were. And restorative plastic surgery is probably the largest growth area within the field of plastic surgery nowadays, because more and more people are understanding that they can get work done in the right hands when things can look very natural and unoperated looking, and as a result are motivated to continue looking as young as they feel. So plastic surgery is divided into three broad categories: cosmetic, restorative, and reconstructive. And all of them are basically there to enhance the individual's self-image, self-confidence, and ultimately make them feel better. Those are the 5 most common myths in plastic surgery. There's a lot more, and we'll discuss them in the future. But for now, I hope you enjoyed those. And if you have any questions, please jot them down in the comment section below, and I'll be more than happy to answer them. If there's any specific topics you'd like to discuss, we'll address those as well. Thanks so much for tuning in and listening. And don't forget to subscribe to the channel, because we're going to have a lot of more interesting videos coming your way.